Welcome back to Business Matters. And now I have the pleasure of welcoming to Business Matters Christine Gallery, Senior Vice President of Planning and Chief Strategy Officer, and Amanda Sarbacker, who is the Practice Manager for the Urgent Care Centers. Welcome to you both.
Thank you so much. Thank you so much for having us, Kathleen.
I'm so glad to have you. And Christine, can you tell us a little bit about this new phase in Emerson's development? Why did Emerson at this point decide to expand into urgent care business?
Yeah, thank you very much for giving us the opportunity to talk about this. We're so excited about this new line of business for us, essentially. So we decided to go into the urgent care line of business because of the consumer. What we see and you see is a proliferation of many urgent care centers, and there's a reason for that. Mm-hmm. People really want to have easy access, convenience of service, and sort of immediate care. Mm-hmm. And we have wonderful physician practices, very high quality, but at the same time, you know, they're not always opened on the weekends or later in the evening. So we wanted to be able to offer a complimentary service to our physician practices so people had easy access to care when they needed it. So it was really in response to this rising consumerism that we see in healthcare.
Yes, excellent. And the cost efficiency of it as well is great.
It is absolutely a lower cost way to receive care that is often not necessary to go to an emergency department. It's a great alternative, and it's really the cost of a copay, a small copay, versus a larger copay in the emergency department. So it's a much smarter way to receive care for really the majority of the things that you need urgently.
Yes, that makes total sense.
Yeah.
So now, how does the urgent care strategy fit into your overall strategy?
Yeah. So essentially our urgent care centers are just another point of access into the Emerson healthcare system. So we have lots of points of access. We have our physicians' offices, we have the emergency department, we have if you're delivering a baby or whatever it might be. And this is just yet another way to connect into the Emerson health system. So we're located where people shop and work and live, and it's just an easy way for them to access care and to access the continuum of care that Emerson provides.
So it's just fantastic because it's such a great holistic perspective on being there at every point in a patient's needs, from birth to older consumers.
And last year when I was here, I talked to you about our health and wellness center, which is moving into a much larger space just in a couple of months. And again, it's this perspective where we want to take care of you where you're at on your healthcare journey. So maybe it's wellness and prevention, or maybe it's, I've just fallen and hurt myself, or I feel like I have the sniffles or something like that, and I just want to walk in someplace and be seen quickly. Or maybe it's something that really is an emergency, you need to go to the emergency department, or it's something routine where you can come to the hospital. But we want to meet the patients where they're at and whatever they need.
Yeah, where you're reaching out into the community. It's not that the patient has to come to Concord now as the exclusive location, obviously, but now reaching out into the community where they are.
Yes, absolutely.
Yeah,
long gone are the days where we expected people to come to us for care. So we have at Emerson embraced the strategy over the last 20 years, really, where we know we need to be in the communities where people live, where they work, where they're traveling routinely, that are easy access. So that started with our Westford Health Center in Westford, and then Groton, and then Sudbury, and now the urgent care centers. We really understand that we need to be out in the community where people are.
Excellent, excellent. And tell me a little bit more about the immediate plans for the centers in the areas that you've located them.
Yes, absolutely. So we opened the Hudson Urgent Care Center in the shopping area where Cabela's is, and that opened at the end of February. And that's been going really strong, very well received, great patient feedback, ease of access. People can use what we've obtained something called Clockwise. So you can go on your phone or your tablet or your computer and you can reserve a spot so you know exactly when you'll be seen before you show up. So that's been tremendously well received. Then we have one opening at the Point in Littleton, and that opens mid-May. And we're really excited about that. It looks beautiful. It's coming right along, so that will be open before we know it. And in addition to the urgent care center, we also have another suite right next door to it where we'll have various specialists from Emerson
Excellent.
who will have office hours there. So we're very excited about that.
Very, very strategic in your planning. Excellent. And how did you come to choose the communities of Littleton, Hudson for your centers?
Yeah, good question. So we were very deliberate about how we chose those communities. And in fact, we used an architectural firm that does a lot of work with retail centers in location analysis. And we understood from the get-go that urgent care is really a retail strategy, right? I mean, you want to go where people are, you know, shopping and going regularly, and maybe they're with their kids. And so we hired this firm, and they did an analysis of our service area and some of the towns kind of contiguous to our service area. And based on certain criteria like population density, drive times, daytime population, number of new homes and how many houses, and also kind of distance from our existing services and practices. We didn't want to be, you know, competing with our own physicians and practices. So we wanted to have a decent enough distance where we knew we were going to be complementary to what already existed. And they suggested Hudson. It was really sort of the absolute dot on the map. They said this is the place to be. And once we knew the town we wanted to be in, we then went ahead with our real estate advisors and looked at various locations, and it was really a no-brainer.
Right.
If you go to that shopping area,
Common.
the Highland Commons, there are many shops there, and obviously a bustling and busy place. So we were really thrilled to have the opportunity to be there. And we did the same, very similar analysis for Littleton, using a lot of the same criteria. And again, the point, you know, really busy area and quite a destination.
And tremendous visibility from 495.
Absolutely.
Great access on and off.
For
Perfect.
both centers. Very easy access to
Yes.
major roads.
Excellent, excellent. And tell me, how are you differentiating Emerson Urgent Care from other Minix clinics and other urgent centers in the area?
Yeah. So we are different from a Minute Clinic. For example, in the Minute Clinic, that is staffed by nurse practitioners, and there's really a limited number of diagnoses that they see. Our centers are staffed by board-certified physicians, and there's a much longer list that Amanda will get into in a moment of the types of illnesses and injuries that we see. So our capabilities are broader than that. And I think the key difference between us and some of the freestanding urgent care centers that you see, things like American Family Care and CareWell, they're staffed by very high quality physicians, and they provide excellent care within the four walls of the urgent care center.
Right.
But the big difference between us, a hospital-based urgent care, and something like those freestanding centers is that once you enter our urgent care center, you're entering the Emerson Health system. So whatever follow-up you may need, if you've broken something, if you've injured yourself, if you need follow-up care by a primary care physician, we can make sure not only make sure that you have the follow-up, but we oftentimes make the appointment for you before you even leave urgent care. We make sure that follow-up is there, so that you are connected into our system. You can see a specialist, you can see a surgeon if you need it. So we ensure that you get the proper follow-up. What we've also discovered, interestingly, is that about 60% of the folks that have come to the Hudson urgent care facility do not have a primary care physician. So here's an opportunity to let them know about the wonderful primary care physicians that we have that are affiliated with Emerson, and to get them hooked up, because it is so important to have a primary care physician.
Yes.
Urgent care only provides episodic care for certain things. You really need a primary care physician who's looking at you on a continual basis, who knows you, giving you annual physicals and checkups. So we really want to make sure that people are connected properly with primary care.
And having that referral base is just perfect.
It's absolutely
really
tremendous. And I think
so
the third thing is, even if you do have an Emerson affiliated primary care physician, the really wonderful thing is our ability to use our electronic record to communicate back to your physician, to let them know you've come to the center, something's happened to you, this is what we've done, this is what we've prescribed, this is what we recommended for follow-up. And so they're able to see that in your record, and they know that you've been there. So there's a real continuity of care that we can provide as a hospital-based center.
Excellent, excellent. Amanda?
Yeah.
Tell us a little bit about the particular injuries and illnesses that an urgent care center would treat.
So at Emerson Urgent Care, we're able to see many things, starting with sore throats, ear pain. We also see lacerations, injuries such as broken bones. We've seen work-related injuries that other urgent care facilities aren't able to see. Yeah, we've seen a wide scope of different services.
And are the doctors always on site?
Yeah, we always have doctors on site.
Perfect.
That's our all-time goal. So we may eventually bring on nurse practitioners, but we still will always have doctors on site. Just different than the other urgent cares.
And can someone literally just walk in, or is it best to use the new technology to make an appointment?
So we can do both. Many patients walk in on a day-to-day basis, but we do highly suggest that they schedule their appointment on clockwise. It's actually very exciting for patients to go on and reserve their spot right on our clockwise system, which is found on Emerson Urgent Care's website. However, if they don't and they walk in, we're able to accommodate that visit just as they would see in their primary care.
That's great.
Yeah, it's a really great system.
And so have you seen repeated patients already that have
we
had
actually
such
were
a
just-
positive experience that
We were
they're
just
right
talking
back?
about
We
that.
just talked
Excellent.
about that before meeting.
Yeah.
We've had many patients come back to Emerson Urgent Care because they were so satisfied.
That's great.
We've had to help patients get their back to their primary care because they really enjoy coming to Emerson Urgent Care. But we are happy to see these repeat patients. It just shows that we're really doing a great job there.
Excellent, very good.
Yeah.
And can someone, what's the time frame for someone to be seen?
So that's one thing that we're really working on being the best as far as this. So our patients are typically seen anywhere from 20 minutes to an hour. So there's a variety depending what the patient's there for. So if they're there for an injury, it might be an hour visit, but they're getting an x-ray, they're getting durable medical equipment. So there's a lot more to an exam with a broken bone versus an earache. But typically every patient is out of the office within an hour, which is really good.
And I know that that's a really important thing to track for your competition.
Absolutely.
Yeah, absolutely.
And patients are happy with that. Typically a patient that's coming in for urgent care, they want to be in and out. They want quality care, but they want to be in and out in a timely manner.
You're right, you're right. And tell me about the insurances that you take at the centers.
So currently we're taking almost all insurances. Yep, so we're credentialed with many different insurance plans such as Blue Cross Blue Shield, Harvard Pilgrim, Tufts, Medicare, Medicaid, and many others. Even if we don't necessarily take your insurance, we will have patients, we will build their insurance and see if we can get it covered for them.
That's great.
Yeah.
That's great. And you're open every day as well as holidays.
We are. We're open Monday through Friday. 8
Accessibility.
a.m. It's great. 8 a.m. to 8 p.m. Saturdays and Sundays, 9 to 5.
That's
and
great.
we're only closed Christmas and New Year's. So even on holidays, which is great for patients.
That's wonderful. I have a question for both of you. Tell me a little bit about what someone can expect at these various locations. I know that there's some special interests.
Yeah.
Do you want to talk a little bit about what we have for diagnostics at Hudson?
Yeah, so in our Hudson and our soon-to-be Littleton location, we're able to draw labs for patients. We also have radiology services, which is really key for an urgent care facility. And we also have a different service that we're able to provide. It's called Stratus Interpreter Services.
Very
so
good.
for patients that come in that are deaf or have difficulty speaking English, we're able to have a face-to-face conversation with them, but we also bring in the Stratus Interpreter Services. And it's high-tech, modern technology with an iPad. The patient's able to communicate with the interpreter on the other end, as well as the provider and the medical
Very
assistant.
important in a medical setting.
Yeah, so it's really great.
Yes.
Absolutely important.
That's wonderful.
Yeah. So in Littleton, as I mentioned, we're going to have what we call the specialty suite, which is right next door to the urgent care. And we research what are the sort of common specialties that people who come to urgent care then need to follow up with. So they include orthopedics, hand surgery, ear, nose, and throat, GYN, general surgery. So there's a wide variety of specialists. So we're focusing on having those specialists have office hours in Littleton. So if you do need follow-up, how convenient is that? That you can literally go right next door for a visit, that you don't have to necessarily go to Concord or Westford, that you can go back to the same location and see a specialist. So we're very excited about that. There'll be many more, I'm sure, joining. So we're really excited to be able to offer that.
That's a wonderful model. That'll be really wonderful to watch how that grows.
Yeah, absolutely. And again, we know it's all about convenience. We know people are busy and they have busy families, busy lives. So we really want to make it as convenient as possible, providing really high quality care in a convenient setting for them.
That's great. Well, Amanda and Christine, thank you so much. This has been so informative.
Thank you.
And we wish Emerson Hospital's urgent care centers the best of success. This is so exciting, your new strategy and your developments.
Thank you so much, Kathleen. Thank you so much for having us.
Thank you.